Hello, this video is suprahyoids and infrahyoids. The suprahyoids and infrahyoids are on pages roughly 253 to 255. And I am going to start the screen share because I want you to see the infrahyoids and the suprahyoids. They are antagonists to one another, and they are bizarre looking muscles. So let's see where they are. All right, so here we are. Suprahyoids and digastric, which is a separate muscle, but kind of part of this group nonetheless. So what do they look like? Well, they are underneath the tongue or deep to the tongue, and then they attach to the superior portion of the hyoid bone, which of course is that floating bone in the neck here. And this is a very odd view because they're showing the hyoid bone as an upside down U. They're trying to get you to see it like this. Okay, that's the view. And it's strange. It's just weird. But all of these muscles attach to like I said, to the hyoid and then to the underside of the mandible in that submandibular fossa there. So you have some strange little muscles that actually sit in these tendinous slings. And this happens a couple times in the suprahyoid and infrahyoid complex here. So again, they're just kind of weird, they're bizarre. The suprahyoids, which is what we're going to start with, they help you chew, swallow, and speak. If you want to highlight that in your book, that's what they do. So they can affect the tongue. They depress the mandible, so they help you open your jaw, right? Versus the temporalis and masseter, which elevate the mandible. And the suprahyoids can also elevate the hyoid and tongue. So again, they are important in chewing, swallowing, and speaking. I am not going to have you learn the origins and insertions, only the actions, okay? Because like I said, they're a little weird. So the suprahyoids include geniohyoid, myelohyoid, and stylohyoid. So here we have an attachment to the styloid process. Let me get of the temporal bone. Remember, it's this pointy bit right here. That's the styloid process of the temporal bone. So we have our suprahyoid muscle called stylohyoid attaching to the styloid process. Oh, that is a mouthful. The thing is, as massage therapists, we're not going to be working on the hyoids very much. In general, we're going to come down through the neck with soft hand and then around to the back of the neck. And we're really going to be focusing on those posterior neck muscles, the scalenes, and maybe SCM. People don't like it when you dig around in their anterior neck, especially up under their mandible, especially around their trachea and thyroid cartilage. People just get oogie weird feelings about that. So we're not going to be doing a whole lot of work like this. But since these muscles do act as antagonists to the masseter and temporalis in depressing the mandible, we do need to talk about these. Okay. So the suprahyoids do have an important role. Digastric in particular, this is digastric here. So this is the anterior belly of it. There's another tendinous sling and it's on the hyoid bone. Then it makes a sharp turn back toward the mastoid process of the temporal bone. And basically what this one does is it depresses the mandible and retracts the mandible. And you can see how it might do that. It pulls it down and back, okay? Again, I don't need you to know the origin or the insertion, just the action of digastric. So anytime you use your tongue and your mandible in depression and tongue elevation, like when you're sucking on a straw, that's going to be the suprahyoids. Now, you can feel them, you can palpate them, because they're actually quite superficial, deep to the mandible here. Anytime you move your tongue around, you can feel the suprahyoids engaging. Okay, specifically geniohyoid and and mylohyoid here. Mylohyoid's a little easier to feel up under here. Okay. These also help affect the position of the larynx, which is your voice box. So that's how they help with speaking, or that's how they affect speaking. Now, since we haven't talked about the larynx yet, that'll be in physiology. I'm not going to go into that right now. All right. This page just shows you the origins and insertions and where these things actually attach. Again, I'm not interested in that for you. So we move on to the infrahyoids. The infrahyoids, as their name suggests, are inferior to the hyoid bone, and they affect the positioning of the hyoid bone and the cartilage here. Okay. They also have a very small role in dilating the dilating one of the blood vessels in the neck. Again, I'm not really concerned about that, so I'm not even going to bother finding that. Okay. So this is what they look like. Again, very weird, very strange muscles. You have thyrohyoid, which attaches to the thyroid cartilage. You have sternothyroid, which attaches from the sternum to the thyroid cartilage. You have omohyoid. Omohyoid is one of the weirdest muscles in the body because it has an attachment on the hyoid, then it has a little muscle belly, then it turns into tendon and is actually held in place with a tendinous sling, though they're not showing it here. And then it forms another muscle belly, and then it attaches to the superior border of the scapula. So it goes down and then back. Very strange. Anyway, the infrahyoids here, again, affect the position of the hyoid and the thyroid cartilage, and are mostly inaccessible only because people don't like you messing around with the anterior trachea here. You actually can palpate these a little bit if you put your fingers on either side of the trachea and push straight back. But again, no one's going to want you to do that to them, but you can do it to yourself. Okay. They depress the hyoid bone and thyroid cartilage. So they are antagonists to the suprahyoid muscles. And that's all that I really need you to know there, okay? That they depress and that they're antagonists to these suprahyoids. They are thin, delicate muscles. And on occasion, you can feel the omohyoid because the omohyoid actually helps tighten the fascia of the neck as well. Again, real strange, but I cannot actually see mine sometimes. That's it right there, that little omohyoid. And if you get on it, you can actually feel the attachment at the superior angle of the scapula. If you push in kind of hard, which I don't recommend, but I am a trained professional, you push in right there. Oh yeah, it zings a little because it's not used to being pressed. And I don't mean like blood vessel or nerve zing. It's just, you can feel it go all the way back. Bizarre. So that's infrahyoids and suprahyoids. And that is it for this video. Have a good day.